Welcome back to another episode of Midnight Mental Talk. I'm Adrienne and my co-host is Leanne. Alright, this week we are discussing drugs, like medications and possible side effects and such things. So this is a topic I am not entirely familiar with, even though I do deal with medications on a regular basis. It's not something that I've thoroughly researched. The first antipsychotic was introduced in the 50s and more were developed. There's a strand from the 50s onward. However, there are now others that were developed in the early 90s. Those ones are called atypical, whereas the ones in the 50s were called typical ones. And when I noticed that about the typical ones, it said that it was often used for schizophrenia and schizophrenic type disorders. So unfortunately, I wasn't able to find, my research skills are a little rusty, so I wasn't able to find out more information about those. Mm-hmm. But that's when antipsychotics and mental health medication started, within the 50s.
Okay.
What I would like to tell you guys right now is that the U.S. Food and Drug Administration admits that probably 1 in 10% of all adverse drug effects are actually reported by patients or physicians. So that means if you are introduced to a new medication, all the side effects that may be possible may not actually be told to you when you start taking it. And then if you are to start taking it and you have an effect that your doctor didn't tell you about or your pharmacist didn't tell you about, they may say that it's just something that's in your head and then you will just, it's nothing to worry about. However, a lot of times, from a lot of quite a few people I know, they have the rare side effects that their doctor just like, oh no, that's silly. I don't know what you're talking about. But what happens is when they do the trial drugs with all percentage of people who actually experience this, so what they tell you is what the majority feel. Dizziness is one of the side effects that they'll offer an example. That's common. So your doctor will tell you that. But if you have something like extreme dry mouth from that medication, they may not necessarily tell you that because maybe only 2% of the people in that trial experienced it. Mm-hmm. The other thing I want to mention before I pass over to Leanne, the psychiatric medications, sometimes called psychotropic or psychotherapeutic medications, help treat mental disorders. And something that was interesting about this, it stated on the research that I was looking at that it changes lives for the better. I don't disagree with that, but with some of the extreme adverse side effects, it doesn't always change a person's life for the better. Mm-hmm. So it helps level the person out who is taking these meds, and so, like I said, most common is very unaffected by side effects, while others may not even be bothered by them. And there's quite a few factors that come with whether or not you may experience side effects, the type of mental disorders that you have, your age, sex, and body size, the physical illness, if you have a physical illness, if you have any habits such as smoking or drinking, and I'm sure drug use goes in that as well, how your liver and kidneys function, your genetics, and other medications and herbal vitamins you may be taking, and diet is also a huge factor. And whether medications are taken as prescribed. So if you're told to take your medication, but you wait till like 11 o'clock in the morning, they may not work exactly as well.
Well, where I come in is having the personal experiences, I guess. So, I guess I can tell you briefly about some of my experiences because I am relatively new to medication. I grew up, against medications. I wouldn't take a Tylenol, an Advil. If I was sick, I'd grab some Halls and have a tea. But other than that, I really wasn't for medication. That was just my personal opinion. I didn't feel like I wanted to put all that junk into my body because, yes, medications do help a person, but there's so much stuff in them. And that is actually harmful to you because they cause, like you said, other side effects, and it could be a multitude of side effects. So many, in fact, that a doctor, like you said, will sit there and say, no, that doesn't happen. Recently, for me personally, in total I've tried 4 different kinds of drugs. No, sorry, I can't say it that way. I've tried 4 different kinds of medications.
Oh, come on. Just say it that way. Say it how it really is.
One was a seizure medication. I think I lasted less than a week on that personally because of side effects. Next one I was on was, I've actually been on for I think a year now. It's called Clonazepam, and it's also for preventing seizures, and it's also used for anxiety and stuff like that.